Hi everyone, welcome back to today's episode on the Wellness Show. As you all know, the Wellness Show is all about giving out information, general topics on health. So today, because this week is actually breastfeeding week, and I am going to focus my topic on breastfeeding for mothers. So if you have mothers or expecting mothers that would because they need to listen to this, and I have a special guest on the show. She is a midwife, a change agent, a caregiver. She's particular about educating and giving out meaningful information about delivery, antenatal, postnatal, and child care to people, especially mothers and the society at large. This is a motive behind a seasonal dishing out information via our social media and so I will need you to listen to the end, because if you are not listening to the end, you will not get the full gist. We have a lot of things to talk about. So if you know anybody, a mother breastfeeding, an expecting mother, tell them to listen to this episode. It is so important, because the person I have on the show today, just believe me that she's going to be giving you meaningful information, everything that you need to know about breastfeeding. You're going to be getting it from this episode. So welcome with me, Nurse Showomi, on the show. So Nurse Showomi, how are you doing?
Good day, Ma. I'm very fine.
Wow, I'm so delighted. I'm just so happy having you on the show today.
Thank you for having me. It's a great pleasure.
This week, 1st of August to 7th of August, is actually dedicated to create awareness on breastfeeding for mothers, and the theme is supporting breastfeeding
for an healthier planet.
Okay, well, for an healthier planet. So, what does it mean to breastfeed? What does breastfeeding mean?
Okay, first of all, there are a lot of myths surrounding breastfeeding and exclusive breastfeeding.
Okay.
Breastfeeding is actually the act of feeding a baby with breast milk.
Okay.
That is from the human, like the mother, breastfeeding the baby. Do you understand? But exclusive breastfeeding is when you are giving the baby breast milk without adding any liquid or solid for 6 months.
Wow.
6 whole months.
6 whole months.
Yes.
You're repeating it.
Yes.
6 whole months.
It is actually very important for a mother to breastfeed her baby exclusively for that 6 months, because that is what is recommended by WHO, the World Health Organization.
Okay.
It's only when there is a medical indication for drugs or supplements, that's when it is allowed to also do that while still breastfeeding the baby.
You know, some people just believe that when you are breastfeeding, especially, I don't know, but I know for Yoruba women, Yoruba mothers, it's when you have a mother-in-law that she's so deep in the culture, and she's telling you, no, this child is not a like, you need to give the child water. That water is good. Who told you you should not give the child water? All those nurses, they'll be deceiving you that you should not add water to breast milk. Is it good to give? You're doing exclusive breastfeeding, and then you're giving the child water.
I get your question, but what I would like to correct is that breast milk is enough for the child for 6 months. The way God has created human beings, and the way the breast has been created, it has every mineral, every nutrient, and anything that the child needs to sustain them, to sustain their growth for 6 months. It's already in the breast milk.
Wow.
So the child does not need extra water or extra milk or extra food or anything. The breast milk is actually sufficient for the child within the age of
6 months.
People that give their children water or even give their children formula feed, they are risks of different diseases.
Like
you know that this breast milk contains some antibodies that help to fight against some certain infections. So when you are giving your child water, the source of water might not be clean enough. It can introduce bacteria to the child, and the child's abdominal wall, that is the stomach wall, is not strong enough, and the immune system cannot fight against this infection. So it can infect the baby. The child can actually come down with some diseases, or it is even research has shown that most the children that are exclusively breastfed have lower incidence of childhood illnesses like respiratory distress, like asthma, or even colic diseases and other things. So it's actually advisable for any mother that wants the best for our child to breastfeed our child exclusively. It also helps in brain development.
Breast milk is just enough for your child to grow because it contains 80% of water. So what's the essence of adding water to it again when your breast milk already contains enough water? What are the barriers affecting breastfeeding in Nigeria?
Okay, Nigeria as a whole, there are a lot of barriers.
Wow.
According to WHO, only 4% of children born, like children within the ages of 6 months, are exclusively
4%. Like that is very, very low.
Very low. So that's the essence of this week, to educate mothers, to educate mother-in-laws, to educate fathers, because when women have the necessary support, they are happy to breastfeed their child. So there are a lot of barriers from the mother side, from the society, from the organization, especially for working class mothers, then also from our healthcare professionals too.
How?
Okay.
How is the healthcare professional coming in place?
Okay, the healthcare professional have fault because some practices do not encourage skin to skin or breastfeeding within the first hour of birth. Wow. Most hospitals, when you give birth to your child, they separate you from your child immediately, trying to care for the baby, which is not supposed to be so. From that moment when you deliver your baby, usually when women fall into labor, we try to prepare their breast. That is, we have cleaned their breast before the labor. So immediately the baby is coming out, the baby is placed on the chest of the woman and is meant to breastfeed immediately if the baby does not have any complication. But if the baby has any complication, it is good for the pediatrician or for them to separate the mother from the baby and take to the ICU, that is the neonatal unit. Yes. But if the baby does not have any complication, the baby is meant to be on the chest of the mother and the mother is meant to breastfeed.
Okay, concerning, I have 2 questions on what you've just discussed. For mothers that they need to give their child, they need to feed exclusively breast milk. For working class mothers, that is just 3 months leave that is being given to them, mat leave. How can they achieve the 6-month exclusive breastfeeding?
Thank God for Lagos State. They actually give their mothers 6 months maternity leave.
What if you're not working on that Lagos State or on that government?
Don't even give their mothers up to 6 months. They say 3 months leave.
And some is even lesser than 3 months.
Yes, this is really stressful, but it should not be an obstacle, or it should not stop you from exclusively breastfeeding your baby. You would ask me why?
Why?
Okay, so the reason being that you can actually express your breast milk into bottles and refrigerate. Okay. You can store breast milk.
For how long can breast milk be stored?
When you store your breast milk under normal room temperature, it can last for an hour.
An hour?
Yes, which is still ideal for you to feed your baby with
that milk.
Yes. Okay. Then if you are putting it in a refrigerator, it can last up to 24 to 48 hours. If it's inside a refrigerator.
Really?
If it's inside a freezer, it can last up to 6 months.
Inside
freezer.
No, I didn't get that. I need you to repeat that side.
I know.
If it is stored in the room temperature, it can last for an hour.
Yeah.
And then if it is stored in the
refrigerator,
it can last up to what?
24 to 48 hours.
Wow, 24 to 28 hours. And then if it is stored in the freezer, sorry.
6 months.
Freezer, 6 months.
Yeah.
For mothers that are working class mothers, what they would do is that they need to store it in the fridge or in the freezer to keep it, and then they will introduce the child. So how can, because it's already stored in the freezer or in the fridge, you need to make it warm
for the child
for the child to drink. What are the things they need to do
the only thing
before they feed the child?
You need to put a bowl of hot water, dip the bottle inside, and it becomes warm.
Wow.
Then you can breastfeed your baby with
it. That's so wonderful. So, working class mothers, they don't have an excuse again. This time, there's no excuse. What are the barriers affecting breastfeeding in Nigeria, and how can it be overcome?
Okay, like I said earlier, we have a lot of barriers at the part of the society, at the part of the mother, and at the part of the healthcare professionals, and also the part of our organizations.
Okay.
The first one I'll talk about the mothers. Most mothers they are not adequately prepared for breastfeeding. Breastfeeding is something that the preparation should have started from pregnancy. You should start your preparation to breastfeed. That's psychologically. Psychologically, when you have it in mind that you want to breastfeed your baby, it helps you. It helps you relax and produce more breast milk.
Okay.
So, and also you prepare your breast during pregnancy.
Okay.
From the third trimester, you have to start cleaning your nipple and massaging it with oil.
Okay.
So once you start cleaning your nipple, at least when you're before 36 weeks, your breast milk, you're supposed to be able to express the breast milk from your breast.
Really? While pregnant?
Yes, if you adequately prepare your breast. So there would not be issues of I just gave birth, I can't breastfeed, my breast milk is not coming out. And another thing I would like to tell mothers is that if you are unable to lactate immediately after delivery, still put your baby to breast. The more your baby latches onto nipple or latches on the breast, the more it sends signals to your brain to produce more milk. So if you start with formula feeding immediately, the baby might not be able to, might not be patient enough to suckle through your breast. It knows that if it tries and it's not coming out, and the
child will just give up immediately.
The next thing, formula feeding is coming out. And again, another thing is that mothers should try to breastfeed their newborn 3 hourly. Like every 3 hours, whether the baby is hungry or not, you try to breastfeed your baby.
What if the child is sleeping?
This is because breastfeeding is an act that needs to be learned.
Okay.
So the baby does not know what it looks like before. You have to teach the baby, and you have to be patient with the baby. So if the baby is very hungry, and the baby is latching on the breast and nothing is coming out, the baby would be angry.
Yes,
and will not be patient enough to suckle. But when the baby is not too hungry and you are placing the baby on breast, the baby would continue to suck. So it still helps breast milk production.
So now, you said mothers should breastfeed their child 3 hourly.
Yes.
So what if the child is sleeping? How can you wake the child up to
you can just cradle the child.
Okay.
If the baby is sleeping, you can actually leave the baby to sleep, and immediately they wake up.
What if the child likes sleeping?
Like you can wake in
sleep for 4 hours.
You can wake in between. You can wake in between.
Okay, that's good. So
also, on the side of the society, we need support for breastfeeding mothers. A lot of mothers think they can't breastfeed outside because of harassment and all things. If our society is supportive enough, we are supposed to encourage mother breastfeeding. Even our organization, they should give break times for nursing mothers to be able to go out to breastfeed their children, even in the daycare.
Wow, that's good.
And also, most organizations are not baby friendly.
Why did you say that?
Most big organizations are supposed to have daycare for their nursing mothers.
What if they cannot afford it?
That if they cannot afford it, they should be able to give mother maybe an hour break in between working hours, and for them to close earlier, so that they will be able to express more breast milk and give to their babies.
I guess some organizations do that by allowing the breastfeeding mothers to close very early. I guess they'll just spend like 4 hours at work.
Yes.
So how can mothers know that their child is getting sufficient milk from the breast?
For example, when you breastfeed your baby very well, at the end of the day, you see while rocking your baby will bob. Yes.
Bob in what sense?
Like pass gas through their mouth.
Okay.
You understand? It shows that
the child is
they are well fed. Yes.
Okay.
Then you feel your breast empty, because once you breastfeed your baby with a breast, you feel it lighter than the other one. And I advise mothers that when you breastfeed your baby with this breast for up to 20 minutes, switch it to the other breast and do like that. Let it take turns so that you don't breastfeed too much on one breast than the other.
Okay, alright. That's good. Thank you so much for that. I've heard a lot of breastfeeding mothers complaining that they feel pain in the breasts, and I don't know why some people experience it and some people don't experience it. So I'll need you to tell us, enlighten us on that. Why do people feel pain while breastfeeding, and what are the tips that can be done to reduce the pain?
Okay, there are a lot of factors associated with having pain while breastfeeding.
Okay.
One, if you are not properly breastfeeding your baby, if your baby is not latching well on your breast, it can cause sore and cause pain.
Okay.
So the way we advise women to breastfeed is, when you want to breastfeed, you can always stroke your baby's lip with the breast, then the baby will open the mouth, which is a natural reflex.
Okay.
So immediately you put your nipple inside the baby's mouth, not on the baby's lip. pointing towards the upper palate.
Okay.
So when the baby closes his mouth, it's going to be on the darker part surrounding the breast, which is called the areola. So when the baby's mouth is on the areola, it helps breastfeeding. It would help the breast milk to come out more and also prevent the woman from having pain. Because that's when the baby is latching well on the breast milk, on the breast. Then also, while trying to remove your breast from the baby's mouth, like interrupting breastfeeding, you don't need to drag your nipple. So babies can just enjoy you.
They can be dragging the breast.
Yes, from the baby's mouth.
Don't remove these breasts.
So what you just need to do, you need to put your pinky finger into the baby's mouth, then it breaks the seal. So that's the easiest way to interrupt breastfeeding without harming you. Then also, when your breast is engorged, especially for working class mothers, they experience it. When your breast is engorged, you can actually take your feeding bottle to your workplace and try to express the breast milk. Or when you get home, you use warm towel. You put a towel into warm water, then use it to compress your breast. It actually relieves the pain.
That's so nice. I am really learning from this section. Because a mother is breastfeeding, they need to eat well. What are the food you can recommend to breastfeeding mothers to take that will help them and also in turn help their child too? And then there's another fact that for a mother that is just feeding on pap and just akara, will the child get enough nutrients from the breast milk? Like, does the mother food, what I'm trying to say, affect the breast milk?
Okay, God is so kind that if the woman is not grossly malnourished, it might not affect the breast milk content, but it's definitely going to affect the mother. Because the breastfeeding mechanism, like, is going to go into the mother's reserve to provide adequately for the child. So it is better for a woman to be adequately breastfed or to be adequately fed. It's better for a woman to feed nutritiously in order to be able to breastfeed her baby very well. And she needs to take in a lot of fluid. You know, you are losing a lot of fluid through breastfeeding, so you need to take in more to compensate for that mechanism. Then also, the breastfeeding mothers are to take more of vegetables, fruits. So the more nutrients you have, the more reserve your baby is able to tap into. But if you don't eat all those, your baby might still have some nutrients, but not. It's going to affect the mother's health. Because breastfeeding takes a lot of practice. Yes, it takes a lot of nutrients and a lot of energy.
Okay, so thank you for that. So when is the best time to stop or demand on breastfeeding?
Actually, stopping breastfeeding is a gradual process. For mothers exclusively breastfeeding their children, they can start introducing solid food or baby food from age 6 months.
6 months, that's formula, right?
Yes, they can start introducing the family food to their babies
from 6 months.
Yes, from 6 months. But food, there's a way we
there's a way you prepare
the child's food, which is different from the way they prepare the mother's food.
Okay, so maybe we are going to have you on the show, like that will be for another episode that we're going to talk about. But is it something somebody can explain on, like somebody will listen and then you will know how to? Wow.
I think our healthcare centers are doing justice to that because they teach their mothers how to prepare winning food. Then also, it is important for a woman to breastfeed their baby at least for 2 years.
2 years?
Yes. In addition to other.
Okay.
In addition to other food. But you keep breastfeeding your baby till 2 years or more.
People, I don't think people can be that patient to breastfeed a child for 2 years.
Breastfeed for 3 years.
So I must ask you this question: would you like to breastfeed your child for 2 years?
Yeah, as long as
they're saying it now. We are saying yes now.
It's actually a psychological preparation.
Okay.
Because this is what I have in my mind. I plan to breastfeed my baby till my baby says I'm okay, provided I don't have another pregnancy. You sure you understand?
Okay. For that, depending on if you don't have another pregnancy, some people said, I heard it, and from an expert, they said you can be breastfeeding while pregnant.
No, actually,
that you don't have to stop breastfeeding the child because you are pregnant.
I would not totally disagree with that.
Okay.
Because the hormones the hormones in your body while breastfeeding is actually different from the hormones while you're pregnant.
Because I was
so when
wondering,
you're pregnant,
yeah,
the hormones might definitely stop breastfeeding. So you just have to stop. And again, the energy you're expending, you're pregnant, you still want to be breastfeeding your child. It's actually not easy.
Lastly, this will be the last question I'm going to ask you, and then we'll end the show. So, what are the importance of breastfeeding to mother and to the child?
There are a lot of importance attached to exclusive breastfeeding.
Okay.
And I know a lot of mothers want to hear this, but they don't want to do it. For mothers, the first thing first for our Get Fit farm and all, breastfeeding enables you to lose your pregnancy weight faster.
Really?
Yes.
Some people add weight when they are breastfeeding.
Yes. You gain weight for 9 months.
Okay.
Then after that 9 months, it has to shed slowly. Okay. So it can't just go in a day. But when you exclusively breastfeed your child, it helps you lose more weight.
Wow.
Then also, it enables bond between the mother and child.
Wow.
When you exclusively breastfeed your child for 6 months, the bond is stronger. The bond is stronger. Then also, on the mother's part, the baby came out from the uterus, and the uterus was actually large.
Okay.
And so when you start breastfeeding your baby early enough, it helps to contract the uterus. So it prevents bleeding and also makes it go back to its pre-gravid state.
Wow. So what are the importance of breastfeeding to the child now?
We have
mentioned about the mothers now.
Numerous advantages of breastfeeding. For example, we have a lot of antibodies in breast milk, and it helps fight against diseases. I think I said it that children who are breastfed, they have lower incidence of childhood illnesses such as asthma, respiratory illness, and some other things. So it helps them, it prepares their body to fight against infection. So the more you breastfeed, the less they come down with infection. Then also, it helps them gain adequate weight. Wow. For babies, you see some babies, they are chubby and you're like, wow, this baby's so fine. Then you ask them, are you exclusively breastfeeding your child? You say yes. Then when you see babies that are exclusively breastfed, you can identify them because they look so beautiful. Their hair, everything about them is actually so nice because they are having the best of nutrients that they could ever get. Wow. Then also, it is easily digested. Okay. For most, in the previous time, constipation used to be a very big problem for newborns. Yes. It is totally getting eradicated because they now, when you give your child breast milk, they become less constipated. They won't even get constipated safe the more you breastfeed them because it is just adequate for them. Then it reduces the incidence of diarrhea. When you start preparing baby formula, if you're not clean enough, you can introduce so many bacteria to your baby, and the baby come down with diarrhea and all. So it helps the baby. It also helps in brain development. Babies who are exclusively breastfed come out very intelligent because it helps the brain develops within age 2 to 5. Sure, you understand? So within that age 2 that you're breastfeeding your baby, your baby has a lot of nutrients for brain development.
That's so wonderful. Thank you so much for enlightening us on the breastfeeding. So I want you to just say one last thing in how many seconds? 40 seconds. Just one last thing. Maybe you want to encourage mothers and
what I would like mothers to take home is that do not ever say your breast milk is not enough for your child, especially within 6 months. Your breast milk is enough for the child. It just takes a lot of technique. If you go to my Instagram page, you'll find out so many articles I've written on how to breastfeed your baby and what makes you feel your baby is not breastfeeding enough. Sure, you understand? So when you are rest assured that your baby is getting enough breast milk, then you don't need to worry about adding some supplements or some complementary feeding.
Okay, so you mentioned about your social media handle, so I will need you to call it out for people because they need to follow you, because for them to learn more, we can't say everything on the show, so they need to come and learn more from you. So can you give us your social media handle for people to follow?
Yeah, my Instagram handle, which teaches more about breastfeeding or generally antenatal and postnatal care, is ANC with no show me.
Okay.
ANC with no show me, all small caps. Then on my Twitter handle at no show me. It brings you to my
Wow.
Twitter handle.
Wow. So the Twitter handle is what? Not show me. So thank you so much for joining us on the show today. I am really happy, and I've even learned a lot, because I was actually thinking, I don't think I want to do 6 months exclusive breastfeeding. It's not easy, I cannot lie. But this one that you've told me, okay, I can store it in the fridge or in the freezer and it will last longer. I guess that is even better. So if the child is in the daycare or with somebody, I can go and do other things, and then the child is still feeding. I'm still giving my child breast milk exclusively. So thank you so much for joining us today on the show, and thank you so much for all the listeners. Thank you so much for listening. I will need you guys to do something for me. I need you to go and follow Noshowumi on Twitter, and then follow her on Instagram at ANC with Noshowumi. And then you also need to follow us too on our whole social media handle at The Wellness Show. Thank you so much for listening to this episode. Kindly share with your friends, share with expecting mothers, share with every woman, because almost every woman needs to hear this. Thank you so much for joining us. See you next week. Bye.